being in a facility like this, just observing the way the patients are at their worst and how much we can do to improve their lives by treating them with dignity and respect, by being courteous, by doing good teamwork and keeping them safe, how they can come such a long way in just a few days with medications and the proper treatment. It makes me want to continue to be able to impact my staff by supporting them and helping them achieve those goals so we can help our patients. I think being knowledgeable, critical thinking skills, and being knowledgeable about our patient situations, being firm with the staff, but being flexible and keeping them accountable for their actions, and always being fair. It doesn't matter what the situation is, there's always two sides to every story, so we need to be fair.
Yes, yeah. There's sometimes when it's so obvious, it's one side over the other, and then the other side decides to show their side.
If I can model all of those things with my staff, with my managers, with my house supervisors, and show them this is how I lead by example for them to follow.
That is the best form of leadership. Like people when they see you put in that work and they can't do it, they go, man, I can't see that.
I don't know. I don't feel like this is work. I feel like if you love what you do, it never feels like work. I get up every day, I come to work loving it like it's the first day.
It's kind of like an unconditional love almost in a way. Like you're never gonna not love your kid.
You come with the attitude every day that you're going to help at least one person. And as long as I can do that, it keeps me motivated to come back. I did not start in behavioral health. I've been a nurse for a very long time. I did everything but behavioral health when I first started, although my first degree in psychology was not one that I did anything with at first. I did a 4-year degree in psychology, then became a nurse. And as a nurse, I worked in hospitals, but not in behavioral health. And I did that for a long time. And I stumbled into behavioral health one day when they needed assistance. And they asked if I would go and help them out at the behavioral health facility. And I never left. It was where I found my true calling as a nurse of the patient population that I felt I could help the most.
That's so cool.
And
there was no prerequisite for you,
I stumbled inadvertently into behavioral health just because they needed assistance that day, and they called me to come and help. And loved it. And I loved it. I grew up in a small fishing village in Nova Scotia.
Yeah, Canada, yeah.
Yeah, so my French, it was my native tongue. I learned English as a second language starting when I was about 9 years old. But I do know when my parents are in town, my Canadian accent will come. The longer I spend time with them, the more my accent comes out.
Well, Claudelle, thank you so much for your time. This was great.
You are very welcome.
Really good.